Late night calls from Prince Harry to his elder brother, His Royal Highness the Prince of Wales, Prince William, and growing concerns over here in the United Kingdom about the ongoing health crisis of His Majesty the King, not to mention Queen Camilla. As ever, let me explain. Morning, nice to see you, chums. Thank you so much for joining me today, and welcome one and all back to London. And of course, I hope you're keeping well, whatever you're doing. You know, health is a tricky thing. Let's be blunt, we can talk, right? I mean, we're all living in this sort of situation now where I had a colleague, and I don't mind sharing this with you, and you know when you put in the repeat prescriptions thing, right? And they just decided to sign off the fact that she didn't need a particular thing without any consultation, without any sort of, phone call or text. So she turns up to collect the prescription, and suddenly now she's in a battle to get that back. You understand how these things work. This is apparently the lovable NHS that we're supposed to be all so grateful for. But of course you get the endless text, don't you, about you must turn up for the shingles jab or the vaccine or whatever, because they can make money on that, you know what I'm saying? And this is the problem when you are in a position, for instance, like His Majesty the King. If you recall, Queen Elizabeth, well, nobody previously in the royal family ever discussed their health battles. It wasn't the thing, and it really wasn't what we wanted either. I don't know about you, but when you're younger, I just thought the Queen was an incredible woman who seemingly never seemed to get ill. Of course, what you have to remember is that these people, and I mean that kindly, have the very best healthcare that you could possibly get. I mean, it's the absolute best, and you go right back into the decades of the royal family. It doesn't matter what era you look at. Even Queen Victoria's physician was the absolute best in that particular era. Of course, when King Charles decided to reveal the fact that he was having treatment for an ongoing cancer battle, that really changed everything, and he felt at the time that this was the best way to be, the transparency way, the new way of the royals. I don't know about you, I'm not so sure really, because let's be honest, if he hadn't have told us, would you have known? Would you have simply put down the weight loss and this sort of, shall we say, a little frayed at his age now, looking a little bit less, shall we say, than just simply just age? I mean, would anybody have known? But of course, somebody somewhere would have tried to get the details. If you remember when Catherine, the Princess of Wales, was in the hospital and all of these sort of debacle around somebody trying to get her medical notes, there's always somebody out to make a buck. Now, the reason why I'm addressing this particular issue is simply because I can tell you what I found out against all the lurid headlines that you're seeing constantly in the newspapers, which are very off-putting, let's be blunt. And also, when you think about it, you see a lot of people who don't have the contacts, who are simply making this sort of thing as to be, oh, it's worse. I mean, I heard one version of events that, oh, King Charles went missing for 6 weeks. No, he didn't go missing for 6 weeks. That was his annual holiday in Balmoral, where he carried on working, doing the red boxes and meeting various members of his family. A tradition that's gone on for over years, but you see how they spin it. And the problem also that you have is, and this is the bigger issue, this is detrimental having these sort of stories, and forget Prince Andrew for a moment, but it's detrimental having these stories because around that, all the good works that they're trying to do, for instance, the connection with the Catholic Church, the meeting with the Pope, the first after 500 years, praying together, it's all historical stuff that we should really take notice of. And, one might say, well, the counteractor of that is that, of course, King Charles was in hot water about the Islamic call to prayer in Windsor Castle, and that's for you to make your opinion on that. I'm just putting it out there. But, what you remember is at his coronation, he said he wants to be the defender of all faiths. And so as you can see down the line, I can see that this is the operative of now what he's trying to do. So how ill really is King Charles? Well, what we got told, if you remember right at the start of this was, well, he was having ongoing treatment. And I think in a very clever way, the certain visits that they've offered and these sort of hot mics, as they call them, the microphones where members of the public and people that have been designated to meet His Majesty the King, they ask a very pertinent question and he answers, I think, very openly and honestly. Behind the scenes, things haven't been going exactly to plan. That far is true. His Majesty the King gets a lot more tired, a lot faster. But then anybody out there, and I know there's many of our friends here on our community, our chums, that are going through very similar things. And the reason why I wanted to highlight this as well is, and I get angry for this, because I've got colleagues who are going through similar things as His Majesty. And you see, this gives, in this terrible world that we live in, this gives employers the opportunity to think, oh, will we get stung for this? Will there be medical insurance? Can we afford to pay this stuff? Should we be paying this stuff? You see what I mean? What you've got, and I know many of you are suffering from this, and as you know, you have my good wishes and prayers. But the thing is, what you've got is a situation where it's a treatable illness. It's not curable, of course, and the phrase that they're putting up there with all of these headlines and stuff like that is, King Charles is dying. Well, let's be blunt, and I remember reading this many, many years ago, and I think it's always stuck with me, this. The bottom line is, we're all dying in one way or another. I mean, some might say I've died a few times in my theatrical career. But joking aside, it's a thing, isn't it? We all start off, if we're lucky, perfect. And from the very off, everything starts to fall apart. 20s, 30s, 40s, you suddenly think, can't get down there as fast as I used to, or you know what I mean? There's always a problem. So to put out a lurid headline is very, very disconcerting, particularly if you are somebody like Prince William. So where does Prince Harry fit into all of this? Well, the problem for Harry is, as you know, he's been really cut off. And this really is all down to his own fault. If you remember when he sat down with NBC and I think Hoda Khabot, he basically started to tell the world that the Queen didn't have the right people around them. And after that particular interview, senior members of the royal family regarding any health matters had to shut him down. This is because Harry might just have a conversation with, well, quite frankly, anybody. Hence the reason when he recently came over here last month to see his father for the first time in months, according to an excellent source, His Majesty the King decided flat out not to have a conversation about his health, simply saying it was all going to plan. But is it? Now, whether you're a fan of Prince Harry or not, it's alarming, isn't it? Because there he is, thousands of miles away, now realising at the most pivotal time of the son and father relationship that he's been cut off. And it's all his own fault. He simply can't be trusted. Now, speaking to people that I know incredibly well regarding His Majesty, there's two things that you have to realise where these headlines are simply lurid. He would not be allowed, for instance, to go really where he is now, across the globe to Rome to have that special audience of a one-to-one with the latest Pope, the brand new Pope, His Holiness, right? It wouldn't be allowed if he was that sick. Also, he came out the other day and went back to the Manchester synagogue to offer his very best wishes to that particular faith foundation. So consequently, what you're seeing is a man who's continuing to work. What I've been told is simply this, that the problem with King Charles is he won't take the moments of rest. So when he does look a little bit more tired, a little bit more frail, well, that really alarms people. When we saw him, for instance, stepping out with, of course, Prince William, his son, obviously William is at the peak of health, the peak of his life, in his early 40s. And naturally, when you stand next to somebody like that, there are sort of imageries where you're looking and thinking, wow, But of course, also, and I have to be fair about this, His Majesty the King has had one or two setbacks. Yes, he's lost weight, and that's apparent in the suits. But anybody who has this particular illness will know that this happens. You also go off your food at certain things, and the things that you enjoyed suddenly become tasteless, and you don't enjoy them anymore. And of course, what you have to do with an illness like this is make sure that you don't worry. Now, one of the biggest problems that His Majesty has is, unlike the Queen, he's a constant worrier, worries about everything, takes everybody's problems on and tries to solve them. That's a good thing, but not when you're ill, you see. And the problem that you've now got, which is really what the palace are trying to manage behind the scenes, and this is where this story has really evolved from, is the fact that obviously the King doesn't need any more stress, any more, drama, but each and every day his younger brother, the former well known as Prince Andrew, is piling on the drama. And whether he likes it or not, it's something that is now down wholly to him to deal with, and he's trying to deal with it alongside the duties of a monarch. It doesn't help that over the pond you've got, of course, your youngest son alongside his wife, the former cable TV actress Meghan Markle, piling it on. Whichever way you look at it, he would have thought at this point in his life, if he was looking down the lens of say 10, 15 years ago, that he would have had the support of his two sons. He's now got the support of the woman that he truly wanted to be with. And whether you like that or not, this is the case, right? And so consequently, you've got Camilla trying her best to keep it all together. But I've been told from an excellent source that she too is worried, because like all wives, men don't take any notice, right guys? We just want to do what we want to do. And the other side of it, just to let you know where you're also at, is that the king really, wants to do all the things that he'd had planned. And illness wasn't one of them. So, you kind of kick it into the curb, don't you? You think, I can deal with that. It's not knocking me down. So very frequently, he has to have moments of rest and respite where, he may have a nap where he never used to before. Now, Prince of Wales, Prince William, was asked about His Majesty the King's health in that Apple TV sit-down interview, and very eloquently, I thought, he said, well, it's all going in the right direction. There's two reasons why he didn't speak about that. Simply because William doesn't believe it's his place to speak about that. He's respectful, unlike his brother, who dashed in front of the cameras. And also, William himself knows about privacy following on from the devastating news about his own wife, Catherine, the Princess of Wales. He didn't bring her illness up. It's all through what he wants to let the world know, because he believes, and I actually agree on this point, being very honest, that illness is a private matter. It should be there for the person to discuss as and when they want. It shouldn't be forced out. So while you see these headlines on a daily basis about the king dying, the true story is the king is actively managing a disease that is incurable for many. Sometimes miracles can happen, as we all know, but it's a manageable disease, and many people can go on to have fruitful and long lives. And as they often say, God save the king. But the bottom line is, it truly, according to that source, doesn't help matters. Remember, the king sees all the newspapers and the headlines all gone through, read to him every single day. It's very disarming, isn't it, for that, particularly when you're trying your very best to get out there. It's a smile, a song, a stage. That is part of the monarchy. And I've been told that we have no cause for alarm at this stage regarding the king's health moving forward. As ever, the palace said, what we really want is just the strength and good wishes for everybody out there. And the one thing you have to remember about King Charles is truly this, that he's never really asked for sympathy regarding his illness. All he asked for, if you remember at the start, for all of us to think, feel and pray for the people that are going through a similar situation, never focusing it on himself. And for that, I'm sure many will be truly grateful. Either way, I've been told there is no cause for alarm, as I say, at this stage. And the bottom line is, regarding His Majesty the King, it's simply business as usual. Neil Shawn in the very heart of London.